Michael.
Hi kiddo, how are you?
Good, how are you?
I'm fabulous.
That's good. So Michael, how did you get into Trager?
So I got into Trager in 1987. I was fresh out of college, 22 years old, had chronic low back pain, high blood pressure, high cholesterol, and I wasn't in the best of health. And I was allergic to pain medications and muscle relaxers, and I found this natural therapy called the Trager approach. And it's a neuromuscular therapy that uses touch and movement to calm the nervous system and relax the muscles, and to change the course of my life. Here I am 37 years later, still doing the work.
Really amazing. What do you know about the history of Trager?
Dr. Trager, born at the turn of the 20th century, at age 18, was actually working on his boxing trainer, and who had some back pain, and he said, "Milton, you have hands." And from that day, Milton went home. He worked on his dad, who had sciatica at the time. And then at that time in the early 1900s, there was a lot of people were suffering from polio and then post-polio sequelae. So he worked on everybody in his neighborhood. From there, after decades of successful work, he became an MD, a medical doctor, and continued to teach until his late 80s.
That's some really good information. How do you think Trager has changed or influenced people's views on integrative therapy?
Interesting question. Trager uses, Dr. Trager's work, even though he's using touch and movement with the body, his whole goal was to reach the subconscious mind, because everything that we experience in the body is projected out from the mind. So he came up with, so where it might have been separated out before, this concept of integrated therapy. How do you work with mind-body awareness, mind-body comfort? How can you use the body to reach the mind and have the body reach the mind? And I believe, just through my experience with the work, that he was at the forefront of that particular movement: neuroplasticity, epigenetics, trauma-informed practices, and mindful presence.
So he really changed the movement.
I think he was a significant mover of the needle, if you will.
How do you think Trager is economically different than massage?
Well, Trager, demographics play a role. Trager's more of a neuromuscular therapy or a somatic therapy, and it might be generally runs a little more expensive than massage, but because it's a lesson for the nervous system, the idea is to educate the body-mind and then work with the client or patient in such a way that they can actually start to use the same concepts that were used in their session, that they can start to incorporate that into their day-to-day. So even though the investment might be a little bit more, it can actually be more lasting, and you might not need as many sessions. So
like it's an investment in therapy.
Yeah, I think it's again, it's an education process. So when you learn about your body and that you actually are empowered and have control over it, it's money well spent.
Thank you, Michael.
You're very welcome, kiddo. Thank you for your questions.